So we're going to do a Psoas technique. This one is going to be working on both sides, left and right, at the same time. It's very much of an integrative technique because we're trying to sort of get an even tone between the two sides, but also an even movement. So let's look at the movement aspect first. The patient is going to slowly lift one foot up. At least they're going to lift the weight up. They might not actually lift the foot off the table, but they're going to start to bring the weight off that foot while they push the weight into the other foot. It's like a walking motion. There you go. You don't have to actually lift the foot up. It's more about the pushing foot than it is about the lifting foot. So they don't have to literally lift it off the table. There you go. Now decrease that movement by about 50%. There you go. Yeah, so it's a small movement. So she's starting to do a movement that's very much like walking. So when I'm in working on the psoas at the time, I'll be able to feel the movement that's happening associated with the psoas. I'll be able to feel the tone of the psoas, but also the rotation aspect that's happening in the spine and through that area to the sacrum. So go ahead and relax. I'm going to find the ASIS. I'm going to start following the slope of the iliacus muscle to be able to get down to the depth of the psoas. So it's like you're kind of going into a slope going medial, which will take you right to the iliopsoas. I can move a little bit medial, moving any visceral or neurovascular tissue off to the side. And now I feel like I'm at the depth of the psoas. Before she does the movement, I want her to lift. Go ahead and lift your left foot. Relax. So I can just fine tune where I want my pressure. Lift the left foot again. There we go. Good. Now I'm right on the psoas on the left. I'm going to go ahead and lift the right side. Right side already feels like there's a little bit more tone. Okay, so now I'm on the psoas on either side. So start slowly doing that movement. It doesn't have to be a big movement. It's just about encouraging an alternating contraction with the psoas. And I can do two things. I can soften the right side, but I can also follow that rotation and help try to get an even movement to where it kind of sinks more easily on the left side. Right side feels like it doesn't want to go, but I can follow it into that movement. And just wait for the tissue to sort of normalize and feel a little bit more similar between the two sides. There we go. Now it's starting to move, starting to soften a little bit too. Doing okay? Definitely want to work respectfully with the psoas because it's very sensitive and you want to take your time and not bully through the tissue. You might also, with this one, find that you work a little bit more on the medial aspect of the psoas on one side and the lateral aspect on the other, which I'm doing on the right side. I'm hooking into that medial aspect and helping bring it lateral. Go. One more time. That's good. Okay, now I'm just going to hold and just have her just do that movement a little bit. I'm not going to do so much this time just to let the body function normalize a little bit.